Hey everyone, welcome to the very first episode of Fair Sessions. My name is Sarah,
And I'm Shantae.
and we are so excited to be here. This podcast has been in the works for a pretty long time now, and I'm so grateful that we're actually here doing this very first episode. The
Finally, I know.
Literally. Just a little bit about ourselves. We are both registered psychotherapists with a qualifying status, and we love what we do. We love being therapists. And I'm sure all of you have had that conversation with your friends where you'll be in deep, raw, uncut conversation, and you have this idea of we should start a podcast. Like it would be such a good idea to start a podcast. Shantae and I have had that conversation many times, and we've decided what a great idea for us to bring our insights as therapists onto a podcast to really share our insights. We want to focus on being bare, meaning being vulnerable, being uncut and raw.
I like that. Sorry, is it my turn? Let's be honest, like talking about mental health in general is very uncomfortable, can be very uncomfortable. Even mentioning vulnerability. So we wanted to create a space where we can have both of those things and we can encourage those things. Even from our own internal vulnerability to vulnerability amongst our friends or vulnerability amongst our families. So that's the kind of community we're trying to harbor right now or create.
Exactly. And our purpose with this podcast isn't to have it be a therapy replacement or anything like that. Even though we are licensed, that does not mean that you should use this as a replacement for therapy. If you are struggling with your mental health and you feel like you do genuinely need some help, I would encourage you to seek out a mental health professional. Really, the purpose of this is to just share our insights, our opinions, so you can take what resonates with you and then leave whatever doesn't resonate with you. All right. So, Shantae, you mentioned that vulnerability is very difficult,
Mhm.
right? And the word vulnerability is thrown a lot in society. When people hear the word vulnerability, they might think, that's hard. I'm trying to avoid that. I don't want to ever be vulnerable. So, I actually got a definition from Dr. Brene Brown. She is a researcher and author. She has spent over 20 years researching vulnerability, and she actually defines vulnerability as uncertainty, risk, and emotional exposure. So she says that, you know, being vulnerable or allowing yourself to be vulnerable can help you create deeper, meaningful relationships with others. And although it is really scary, that is okay, right? It's just about really reframing what vulnerability is. Vulnerability is an act of courage.
Mhm. Yeah, and we like to, especially like my first time clients, just letting them know that reaching to the point where you can say, hey, I need help for something is so major. And
Mm-hmm.
it's literally the bravest that you can be to go ask for help. It's easy to just, well, I won't say it's easy, but it's more common to just feel like you're drowning and wanting to cover that up, just to not let
Mm-hmm.
anyone see that or not to be seen as less than, but to see that you're drowning, but wanting more for yourself and knowing that you do want to be better and then taking that step to actually reach out and be like, hey, help me. Like,
Mm-hmm.
help me, throw me a life raft because I want to be better. I don't want to be here. Is
Mm-hmm.
it's
Right. And with vulnerability too, it really is an act of putting yourself out there, perhaps saying things without really knowing what other people or how other people are going to respond. So that's really scary because our brains are wired for protection, not emotional risk. And
Mhm.
vulnerability is an act of emotional risk because there's lots of uncertainty on what the outcome is going to be.
Yeah.
There's actually been some studies done in neuroscience. It shows that rejection activates the same part of the brain as physical pain,
Mm.
right? So if rejection is a possibility
Yeah.
of vulnerability, possible outcome, then of course people are going to be terrified to be vulnerable. And I think with therapy or even taking a step deeper into your own existing relationships with the people in your life, allowing yourself to get there is very difficult, but it can also be so meaningful in enriching our relationships with
Yeah.
others.
Yeah. I love how you broke that down because it makes sense like when you can see it in like a neuroscience type of way because
Mm-hmm.
a lot of the things that we go through we don't realize how much our actual bodies like play a role in that or how our
Mm-hmm.
actual responds to our trauma. I feel like sometimes we think that we're separate from our brain, like the brain's doing its thing to like make our body function, and then we just have our thoughts separately, and there's no like
Mm-hmm.
it's sometimes hard to see the correlation between them. But our brain goes through a lot, and it's responsible for a lot. Um, as much as we see it as this like separate entity, like mind, body, spirit is real. Like
Mm-hmm.
not taking time to slow down, or listen to your body, it affects your brain and vice versa. And it's like when you go to therapy, it's like learning to build those toolboxes to ensure that your mind, body, spirit are all navigating in like one continuous path without any blockage. Because if one's blocked, it's going to show up somewhere else.
Mm-hmm. No,
Just
that's
having
a
it in
really,
mind for
yeah,
sure.
that's a really good point. And I think vulnerability and shame, when I think of those two things, they kind of go hand in hand, right? Many of us are very scared of being vulnerable because being vulnerable means that we need to remove that mask.
Yeah.
We need to
Mm,
remove the mask and think about how often people wear masks throughout the day, right? At work, at school, perhaps even in friendships or
yeah.
relationships, right? Feeling this need to wear a mask all day can have you feeling very drained at the end of the day because by putting on this mask, what you're doing is you're sending this message of I'm not letting you see the real me.
Mhm.
I am protecting myself. This is the version of myself that I have. I think of like chiseled, like you're chiseling this ideal version of who you actually want to be or who you think people want you to be. So you're wearing this mask all day long. There's lots of shame, which obviously it's going to be difficult to be vulnerable at that point when you're so used to hiding who you actually are.
Yeah.
That's something pretty common that I find in my work as a therapist of people feeling the need to mask. And so to kind of shift gears a little bit, if working with a therapist can help someone become more vulnerable or develop some tools for that, why do you think there are so many myths about therapy? And
Yeah.
perhaps we can identify some common
Yeah.
therapy myths.
Oh my goodness. I feel like, especially people who have not done therapy, because I find that whenever I go into consultations, there's either people
Hmm.
who completely know nothing about therapy at all, or they've been to therapy and they've been to multiple types of therapy, not knowing beforehand which one would work with their personality or work with their issues. Um, but I remember when I think about therapy, or if you're to think about like the poster for what therapy is in your brain, you're,
Hmm.
you're like laying on some couch while someone's
Hmm.
talking, taking notes, right?
Yeah.
so serious and it's also clinical. It's probably you'll probably think that you're trying to get some sort of like diagnosis for a mental health disorder, or you need one in order to come to therapy. Um, those are some things that do come to mind when I do have those like consultations with like new clients, and showing them that it could be completely different from that. It does not have to be this sterile clinical um, environment. Because come to think about it, who feels okay to open up in a hospital?
Mm-hmm.
Like, who
Mm-hmm.
wants to talk to anyone who is so clinical and just seems very unapproachable and unreachable?
Mm-hmm.
And I think at least this new wave of like therapists or the people that we've been to school with and the things that they've been talking about and the environments that they've been wanting to create is the complete opposite of that.
Yeah, and there are so many therapists out there, meaning they each have their own style, therapeutic approach and style. So there are therapists who are more on the clinical side, more structured, more formal. So that might work for some people. Some people might have that preference of wanting someone who follows a certain structure, is more clinical. But what I found from my personal experience as well, Shantae, is that the therapeutic relationship is so, so important. It's not just the tools or the frameworks that your therapist uses. Obviously, that's very important as well. But if you have those tools in place, but then you don't have a solid therapeutic relationship,
Mhm.
I find that there's this disconnect, right? So it's all about finding the right therapist for you,
Mhm.
right? And that's why it's so great that there's so much diversity in this field because with patients, it might take one, it might take five, it might take 10 consults before
Mhm.
you actually find the right therapist. Um, but yeah, I think it's just about knowing that not each therapist is the same. They all have their different approaches. And you don't need to be diagnosed to go to therapy. You don't need to be in a crisis to
Mhm.
be in therapy. You can learn a lot about yourself. Therapy is also about exploration, about self development, right?
Mhm.
It's not all about, oh, I have these symptoms. I need help with symptom management.
Yeah.
So let's talk about myth number two, which is talking to a therapist is just like talking to a friend.
Yeah.
So I hear this one all the time, and don't get me wrong, good friends are amazing for support, but therapy is a totally different space, right? If we think about friendships, usually friendships are two-sided, or hopefully friendships are two-sided, and your friends will have a bias. They
Yeah.
know a lot. There's always going to be a bias, even if they claim to stay neutral. They know too much. They know
Mhm.
too much about you, about your past experiences. It's really hard to have this objective, neutral view, right? A therapist, in school, we are taught to really look at each client as their own individual entity, and we don't let our own personal biases interfere with the therapeutic process. The therapeutic space is just for you. So perhaps in your current relationships, you tend to be the listener and you feel like no one listens to you. That's something that I've recognized a lot in my clients, where they feel like they're there for their friends, for their family members, but no one is actually there for them. So it's a space where it's your 50 minutes or your hour, whatever, how long it is, to vent, to release, to talk about your trauma, and your therapist's role is to listen to you attentively and also to not convey any sort of judgment.
Mhm. Yeah. I think even more than that too, we're also trying to look for patterns or even just noticing, being a little bit more
Mm-hmm.
observant of the things that you're saying. So I remember like if I'm in a conversation with Sarah and we're just talking shit, like we're just we're just talking.
Mm-hmm.
I'm not looking in that moment for like a pattern or anything like that. I'm just here to support my friend. And if she ride, we ride. That's how it feels.
Mm-hmm.
But if you're in when you're in session, it's listening to what the person is saying, seeing just being very observant of like even the tone of voice that they're using. Even if I see that they're laughing so much when they're talking about trauma, okay, what is that? You know,
Mm-hmm.
it's like finding different things to explore and really draw their attention to their own patterns, or patterns of the other people that they're talking about who are a part of their lives that are causing them stress. So really being able to dissect a conversation while it's happening is, I guess, I think it's one of the coolest things about therapy.
Mm-hmm.
Just having just come up with like a 2 second synopsis of this whole rant that you had put together,
Mm-hmm.
right? And breaking that down for you and letting you see those different those different troubles that are coming up. Just giving you that third perspective that isn't fully on your side, but also isn't fully like against you. Just finding,
Mm-hmm.
giving that middle ground, that true, authentic, this is what I'm seeing. You let me know if this is right or wrong, and that's where that relationship comes in because it's collaborating on this, your problem. Like, how can I help you
Mm-hmm.
eventually? And not help you as in I'll listen and I'll tell you all the things that you want to hear because that does come up
Mm-hmm.
sometimes where they're like, I don't want you to tell me everything that I want to hear. I'm like, that's not my job. And if I feel like I'm doing that, then I don't feel like I'm doing my job or I'm doing
Mm-hmm.
you any justice, right? So building that relationship to know when to challenge you on on even your mess ups or even your faults, or
Mm-hmm.
challenge you to want a little bit more for yourself. That's
Mm-hmm.
that relationship coming in handy.
Yeah, absolutely. I agree with that 100%. And I think challenging clients can be such a great, it could be so great for their goals, for their development, because perhaps they don't have anyone in their life that challenges them. And as therapists, we're not going to challenge you to give you a difficult time or to judge you. Like, that's not the intention at all. But sometimes when you're so stuck in your way of thinking, you might think like, yep, this is 100% right. This is the way I think. But having another perspective, a perspective that is fueled by just, good intentions and identifying patterns and things like that, it can be really refreshing to get a different perspective. Even my own experience as a client in therapy, I love when my therapist challenges me. Remember at first, I'm like, damn, you're really out here challenging me.
Yeah.
But that's, again, this goes back to the therapeutic relationship and how important it is.
Yeah.
Once you've actually established that and you have trust in your therapist, you know that they're not challenging you to judge you or to make you feel away. It's really just to help you grow.
Yeah.
So that brings me to myth number three is that my therapist will judge me or think that I am crazy. I've heard that where they'll say, I'm really scared to open up to a therapist because I'm scared that, they're just gonna judge me or think that I am a crazy person and all these assumptions.
Yeah.
Um, the thing, I'll just speak for myself here as a therapist and my own experiences. The reason why I am in this line of work is because it really comes from a genuine place of wanting to understand people and wanting to help people. And your therapist, if it's a good therapist,
Mhm.
is not going to go into this session judging you. That is not
Yeah.
the purpose at all. Okay. Um, we have heard many, many things that
Yeah.
could be from an HBO movie or show about people's lives, right? And it's never from a place of judgment
Mhm.
because it's really from a place of understanding and compassion. Do
Yeah.
you have anything to say about this one, Shante?
Um, I just basically my view of people just in general is knowing that not everyone's black and white. Like no one's all good or no one's all bad.
Mm-hmm.
It's just trying to see that person for who they are. I think even from the
Mm-hmm.
first consultation, like really getting to know during our intake sessions, that's why we have them, right? Getting to know this person and how this person functions. And that in itself is already like fascinating because each human is just full of different complexes. And it's so awesome to like just see them be vulnerable and talk about it and talk about the way that they think. So it's very hard to be at least judgmental for me. It's more just so interested. Um,
Mm-hmm.
in, like their inner mechanics. So
Mm-hmm.
judgment is already off the table. It's like going through exploring a new cave,
Yeah,
basically. You know,
that's a good way to put it.
you know, and just being surprised at what comes out, um, being being proud when they make those changes, like literally following along the life of someone else. It's like
Mm-hmm.
watching a kid grow up.
Yeah.
There's so many parts to that. Um, and if you view it from a place of non-judgment, you see so much more.
Mm-hmm.
See so much more, and you're able to give so much more grace, and even
Mm-hmm.
implore them to give themselves grace. Yeah.
And that's not to minimize anyone's experience either, because I have heard people say that, they've had some experiences with therapists in the past where they did feel the judgment,
Mhm.
or therapists would say something that would convey just something very off-putting
Yeah.
in response to someone sharing something very vulnerable. So of course, it does exist, right? There are therapists out there, unfortunately, that might be conveying some sort of judgment, but don't let that one experience be it for you, right? Don't let that be the reason why you never explore therapy ever again. Because I promise you, I know so many therapists. Shantae is one of them. She is the most warm, loving, non-judgmental person. So they do exist too. Great
Mhm.
therapists that are really in this field because they want to help people, and they want to offer compassion and grace and understanding and curiosity, which is super important.
Just
Mhm.
thinking about the judgment too, also thinking about culturally. That has also been a big thing where clients are, I guess, meeting other therapists who may not be from their cultural background, and then there's like
Mm,
that being an issue as well.
mhm,
And more than people know, like it can be an issue if they're not trained properly or they don't check their own biases. So that unfortunately does come up, and knowing that you do not have to stick with those therapists. If you go into a consultation or you go into that first intake session, you're not locked in for life. Do you know what I mean?
mhm.
Say, okay, I don't like how I feel here and I don't want to continue. And knowing that you have the right to pull the plug at
Mhm.
any moment if you
Yes.
feel like that person is judging you.
Mhm.
I love to say choosing a therapist is like dating. Like you
Mhm.
have to maybe you'll get it right on the first try, or maybe you'll get it right on the 67th try. But,
Mhm.
not letting those things discourage you because there is somebody out there for you. Like we
Yes.
absolutely promise. Um,
Mhm.
so don't feel locked in if you don't feel comfortable with that person.
Period. Okay, so our final myth. If I go to therapy, it means I am weak. This one is one that I struggle with this myth a lot, because I truly believe that going to therapy is not weakness, it's actually an act of strength. It
Mhm.
is so difficult to really look inward, to process your trauma, to like focus on self-discovery. Those things are so, so difficult. It's not
Mhm.
easy to do that. And it takes a lot of vulnerability and courage to do these things. So, again, perhaps it was your upbringing, perhaps it's the way it's portrayed on media or in society, and this idea that therapy equals weakness. No, therapy equals strength. And, I think that reframing it in that way could be really helpful. Um, but I will say, even from my own experience as a client, I remember thinking, I don't need therapy. I'm a therapist. Like, why would I need therapy?
Yeah, yeah.
I know all the tools and tricks and all these things. Um, so there was a point where I'm like, no, I don't deserve to be in
Hmm.
therapy. But then I realized, no, I do deserve to be in a therapeutic space because I know the power of a therapeutic space and to be on the other side of it, to have someone listen to me, to have 50 minutes dedicated to just me, really working on all my traumas, processing my emotions.
Yeah.
The act of release, like I think the release that happens in therapy is so powerful because many of us tend to just store it all inside, put it in the back burner, push through life, and just hope that, everything will be fine.
Yeah.
But I've really learned that no, it can be very relieving to get
Mhm.
it all out there, especially to someone that you trust.
Yeah. Especially even just being able to put words to feelings, because sometimes
Hmm.
we're harboring things in our brain and our brain just feels like noise. You're
Yeah.
sometimes you're not even hearing words, it's you just feeling that noise. So being able to just let go in an environment where whatever is being brought out is being unraveled and being listened
Hmm.
to and being like just dissected. Um, it's like now I can put basically words to my emotions. Like the
Hmm.
turmoil that I'm feeling, now I can say, oh, what I'm feeling is sadness. What I'm feeling is loneliness. And it may be because of this. So maybe if I change this, now I'll feel a little bit better. But it's just being able to make these thoughts a little bit more, a little less arbitrary and more plain, like this is how
Hmm.
I feel, and
Hmm.
realizing that too. And to go with your point too, like, therapy is self-care. I think
Hmm.
therapy is the greatest self-care that you can do for
Hmm.
yourself. And if we all feel like we should go and we deserve self-care, this is just one of them. This is self-care for your brain, self-care for your
Hmm.
emotions. Um, just overall caring about yourself a little bit more
Hmm.
a great way to do it. Or even to learn how to care about yourself a little bit more. People do come to therapy to learn how to care about themselves, learn how to give themselves grace a little bit more,
Hmm.
learn how to increase their self-esteem, increase how they see themselves, find value in themselves a little bit more. You can all do that at therapy.
Hmm. Yeah, that's a good point because I think uh, people go into therapy thinking, okay, just gonna work on my emotional regulation or process my trauma, but there's so many possibilities within the therapeutic space, so many different goals, and that's another thing too. You might not even know what you need from therapy once you start it. But which is why when you have a therapist who takes more on a collaborative approach, you're able to both identify, okay, what are areas of my life that I really want to work on, areas within myself, my thought processes, my relationships with others. Then you can really identify what it is you want to work on. So it feels almost limitless,
It is.
what you can accomplish in the therapeutic space. Okay, so we've talked a little bit about how difficult vulnerability is, and we debunked some of the common therapy myths. And since we are basically conveying that vulnerability is so, so important, let's talk a little bit about how to lean into vulnerability, right? Because we're saying you need to be vulnerable, vulnerability is so important. Now, how can we actually lean into it? So I do have a few suggestions here because I think part of vulnerability is also um, being able to assess the current relationships in your life and to identify who are my safe people. I don't want you to practice vulnerability with people who you think are not safe, right? So, step number one is to identify who are my people, who, when I'm around them, I feel like my nervous system feels very safe and calm. So, yeah, step one, identify your safe people and practice vulnerability there. So, these are people that you can trust. Now,
Mm,
if you assess your relationships and you conclude that there's no one in your life that you feel safe around, at that point, I would encourage you to find a therapist.
mm,
What do you think about that?
100%. Because even just being able to like reach out, and even if you do that one consultation,
Mm-hmm.
if there's so many things that happen in a consultation. I know it
Mm-hmm.
says 15 minutes, but
A
those
lot that can happen in
15
15
minutes,
minutes.
there's so much.
Mm-hmm.
And even just being able to speak those words out loud, like I said, sometimes everything's in our brain and we think like we know, like there's words in there, but sometimes it's
Mm-hmm.
just feelings and emotions. But then coming in and we ask that one question, what's brought you here? You
Mm-hmm.
know, and then you actually have to put that now, force yourself to put what you're thinking into words and actually
Mm-hmm.
hearing it out loud and now being like, yeah, this is really how I've been feeling and this is really what I need help with. You know, we can't recommend it anymore. We can't recommend it anymore than to just reach out to somebody
Mm-hmm.
out there if you don't
Yeah.
have it.
And I think another, something that you mentioned earlier, another way to practice vulnerability is by naming your emotions,
Mhm.
right? Putting words to how you feel. Many of us are so used to just saying, oh, I'm fine. It's whatever. It is what it is, right? What you're doing when you say that is you are avoiding your emotional experience. So remove I'm fine from your auto response
Yes,
vocabulary.
your
I think,
autocorrect, everything. That's
yeah,
why.
especially as I mentioned, like with your safe people, right?
Yeah.
If your friend asks you, hey, how are you? Instead of saying, I'm fine, perhaps practice pausing, really thinking about, wait, how am I actually feeling today? And verbalizing, you know what? I'm feeling really shitty today.
Yeah.
I had a shitty day.
It's like
Hmm.
not going and trauma dumping on people because that's been a big thing. You don't know where
Yes.
these people are. You don't know where these people are in life. You don't know what you can say to trigger these people. So
Hmm.
if you if you're at a place where you don't have a supportive system and then you're just going outside just talking to random people and just
Hmm.
dumping everything on them, that could inadvertently mess cause harm to them, right?
Hmm.
So finding the spaces where that is welcomed as well,
Hmm.
you
That's
know.
a really good point. And that's also like going back to the myth that talking to a therapist is like talking to a friend.
Mhm.
The difference between a friend and a therapist is that we have the training and, the knowledge on how to not feel the effects, or we do feel the effects at times, but at least we have the professional development of the training to not let it interfere with our personal lives. Someone who doesn't have access to that level of training wouldn't know how to not let whatever you say impact them,
Mm,
right? So also, yeah, being very careful with how much you trauma dump. And that's not to say that you should never go to your friends um, to vent to them, but just being mindful of perhaps the frequency and also considering what their emotional capacity is on that particular day. Yeah. So practice naming your emotions, as we mentioned. And being vulnerable also means being really honest with yourself, right? Checking in with yourself on a day to day basis. How am I feeling? Something that can be really helpful as well is using something called the feelings wheel. Um,
mm,
we can put it in the description
yeah.
because there are so many different feelings out there. There's words for
There are
feelings,
words for them, right?
and we're so used to saying things like I'm fine, I'm sad, I'm happy, I'm overwhelmed, right? But there are so many more specific words that you actually might be experiencing or emotions that you are experiencing, and it's really important to learn how to specify what it is you're actually feeling, because that's really the only way you'll be able to regulate. You can't regulate an emotion without knowing exactly what that emotion is.
It's like going to war without like a plan or a battle, anything.
Yeah.
Um, and it's like you're starting off on one foot, right? So we
Mhm.
need to know the monster that we're fighting before we're able to fight it.
Yes.
We can't just walk in blindly.
This is Shantae's feelings wheel that she puts in her purse and all her bags.
Like clutch, you
It
know.
comes
So
clutch.
yeah. So you see, happiness have different words attached to it that convey the same
Mhm.
thing. Same as sadness, same as yeah, same as surprised and peaceful. Like there's so many words that can convey our
Mhm.
emotions.
I was actually watching The White Lotus yesterday, and on this episode, someone had said, one of the characters said that underneath anger, there's always
Mm,
sadness and grief.
that's a bar.
And that was, I was thinking about that after she said, I was like, wow, I
Hmm.
think there's lots of truth to that. And many people are conditioned to express anger. They know how to express anger very easily. That's what they turn to because of their challenges with expressing things like guilt or
Mhm.
sadness. Again,
Yeah.
it's that masking, right? We know vulnerability is hard, but we also know it's necessary for growth and for connection. So, how do we start getting more comfortable with it?
That's a good question. There are a few things that you can do. First, as we said, a lot of things are how we talk to ourselves, and how we connect vulnerability with weakness. So the first thing is reframing what vulnerability is. Um, so instead of seeing it as that weakness, see it as courage. Brene Brown says that vulnerability is the birthplace of innovation, creativity, and change. So these words now, we're moving from weakness to innovation, something that's creative, something that is promoting change. So simple tweaks of like how we're talking to ourselves and how we're um, selling these things to yourselves, like selling the idea of what vulnerability is to ourselves in a newer and more healthier way, will help us make that change a little bit easier. Just day by day, tweaking how we're thinking about it. If I wake up and I think of vulnerability as like me being innovative and me being wanting change or seeking change,
Mm,
I'm more willing to do it, because now it just sounds a lot better in my head.
mm-hmm,
And then there's second, starting small, like we just said, Walter, it doesn't mean oversharing with everyone, but choosing safe people and safe words, where you can practice these emotional risks, in small manageable steps. So maybe day one is just thinking about it differently. Let me not see vulnerability as weakness. Let me just see it as strength. Um,
mm-hmm,
Start with that. If you go a week thinking about that, building that up in your head, now I can actually, how can I take this outside of just thinking about it as strength to now putting action behind it? Like now I'm gonna go seek people because now I see it as strength. So the next step is me seeking. And then the next step after that is me setting goals and then pursuing those goals, but like taking it in baby steps. And there's some days that you're going to take 10 steps forward and 2 steps back, and that's okay. That's all part of the process. But knowing that you're on that road for change and not let it
mm-hmm,
shift in your head. And then last, embracing the imperfection. Again, taking 2 steps back some days. We live in a world that pressure is that just pressures us to have everything together. But that real connection happens when we let ourselves be seen fully. Like, imagine how much better you'll feel if you can just have that one person to see you for everything that you are, and they're still okay to be around you, and they're still happy to want to help. They're still happy to want to be there. Just giving yourself grace and giving everybody else the opportunity to give you grace as well.
So I love the idea of little steps, right? Starting small. We're not here telling you that you need to, overshare with everyone tomorrow. It's just the little reframing things, taking it day by day, letting go of this idea of perfectionism. We live in this world where we think perfectionism is what will actually help you develop deep relationships with people and make you more likable. But the ability to be imperfect and to embrace it and to not really like let it get to you, people see that as, wow, this person is human.
Yeah.
Humans are not perfect.
And we're all
Right?
seeking
So,
that human experience. Like
yeah.
as much as we don't think so, like we're all after. We love, there's a draw um
Mhm.
when we see somebody who's imperfect and they're so confident about it. Like we're
Yeah.
all in. We want to see, we want to see every aspect of their lives because wow, shit, they feel like me, you know.
Hmm.
We're just brave enough to put it on the internet, you
Yeah.
know, or brave enough to do it out in public and in real life. And there's a part of us that wants that for ourselves as well,
Hmm.
to be accepted by the world with our imperfection.
Yeah. Thank you all so much for watching our very first episode of Bear Sessions. I hope that it was insightful and I enjoyed this so much. I enjoyed doing this with you, Shantae.
It's always a good time. Um,
Always a good time.
you know, our aim here is definitely to just like if you can walk away with one chunk, one golden nugget, um, on your endeavors to healing yourself, um, even better. And this podcast is not just for like other therapists or newer therapists. Like we kind of just want everyone to come and take as they and fill their soul or fill their cup.
Hmm.
And let us know what you guys are struggling with. Um, Let us know things, different myths that are coming up for you, different biases that are coming up for you, different things that you would need help with, or you just need a different perspective on. But yeah, we welcome all. There's
Hmm.
no specific audience that we're like shooting for, but we just want everyone to come with an openness.
Yes. And also, if there are any other assumptions that you have about therapy that might be preventing you from seeking a therapist or from booking a consult, please let us know. What are some of the assumptions that you have or beliefs? We're
Mhm.
not here to necessarily challenge you on those beliefs. Everyone is entitled to their own opinions. But if we could add some insight to some of those beliefs or even speak on it, we'd love to do that on this platform.
Yeah, for sure.
Okay, well, we will see you in the next episode. Please like, comment, and subscribe.
And follow us at Baird Sessions Pod on Instagram.
Yes.
On Instagram.